Hi everyone, it's Dr. A, and in this video we're going to investigate the action, origin, insertion, and innervation for muscles of the upper extremity. Now, right before we get started, I'd like to provide you with a visual for how to recognize the location of some key muscles on the forearm, and feel free to give this a try while watching. If you would, start by holding your left arm up in front of you with your elbow bent at about 90 degrees. Now, place the thumb of your right hand underneath your elbow and allow your lesser fingers to rest on your forearm like it's shown on the picture here. The location of each finger represents the location of the muscles we'll find on the forearm. Starting with the index finger, we have the Pronator Teres. With the middle finger, we have the Flexor Carpi Radialis, and with the ring finger, we have the Palmaris Longus, and with the pinky finger, we have the Flexor Carpi Ulnaris. The first muscle that we'll begin our investigation of is the Pronator Teres. This muscle originates on the supracondylar ridge of the humerus, noted here on the image, and the coronoid process of the ulna, noted here, and it inserts on the radius just inferior to the radial tuberosity. And as we might have imagined, based on the name of this muscle, it performs pronation of the forearm. And lastly, its innervation is the median nerve. Next, we have the Flexor Carpi Radialis muscle, and its origin is on the medial epicondyle of the humerus, and it inserts at the base of the second and third metacarpals. In terms of its action, this muscle gives us the ability to perform flexion of the wrist along with radial deviation. Now, one of the things we can use to help us remember the actions associated with this muscle is its name. For example, we know it will perform flexion based on the beginning of its name, which starts with flexor. And the middle portion of the name gives us an indication that movement is going to be happening at the carpals and or the wrist. We should also consider that the final part of the name is radialis. In other words, the name of this muscle tells us that it permits muscle movement towards the radius, and the action that fits this description best is radial deviation. Last but not least, the muscle is innervated by the median nerve. Next up is the Palmaris Longus. It originates at the medial epicondyle of the humerus, and it inserts on the palmar aponeurosis, also known as the flexor retinaculum. The Palmaris Longus helps us primarily to perform flexion of the wrist, and it is innervated by the median nerve. Next up is the Flexor Carpi Ulnaris. This muscle originates at the medial epicondyle of the humerus, and it inserts at the pisiform, hamate, and base of the fifth metacarpal. Its actions include flexion and ulnar deviation of the wrist, and just as we mentioned previously, the name of this muscle gives us an idea of its actions. For example, we know it will perform flexion based on the beginning of its name, which again is flexor. And as we noted previously, the middle portion of its name gives us an indication that movement is going to occur at the carpals and or wrist. And considering that the final part of the name is ulnaris, we know it's going to perform movement towards the ulna. And the best movement to describe that is ulnar deviation. Lastly, the ulnar nerve innervates this muscle. Next up, we have the Extensor Digitorum Superficialis muscle. This muscle originates on the medial epicondyle of the humerus, a portion of the ulna, and the anterior border of the radius, and it inserts on the middle phalanx of fingers 2 through 5. And as its name suggests, it performs flexion of fingers 2 through 5. And last but certainly not least, it is innervated by the median nerve. Next up, we have the Extensor Carpi Radialis Longus. This muscle originates on the supracondylar ridge of the humerus, and it inserts at the base of the second metacarpal. And as we've noted previously, we get an indication of the movements this muscle produces by the name of the muscle itself. In terms of movements, it performs extension of the wrist and radial deviation, and it is innervated by the radial nerve. The extensor carpi radialis brevis originates from the lateral epicondyle of the humerus, and it inserts on the base of the third metacarpal. This muscle performs extension of the wrist along with radial deviation and is innervated by the radial nerve. Next up on our list is the extensor carpi ulnaris. This muscle originates on the lateral epicondyle of the humerus and it inserts on the base of the fifth metacarpal. In terms of its actions, it performs extension of the wrist in addition to ulnar deviation, and it is innervated by the posterior interosseous nerve. Next is the Extensor Digitorum muscle. It originates on the lateral epicondyle of the humerus, and it inserts on metacarpals 2 through 5, and the 2nd through 5th distal and middle phalanxes. And as the name suggests, it performs extension of the digits or fingers. And the nerve that innervates this muscle is the posterior interosseous nerve. Next, let's take a look at the supinator muscle. It has 2 origin points. First, the lateral epicondyle, and the second is the supinator fossa of the ulna. The muscle inserts on the radius, and its action is noted by the name of the muscle. So with that, we know it's going to perform supination. And lastly, the nerve that innervates this muscle is the posterior interosseous nerve. Next up, we'll be looking at 2 groups of muscles that we'll find on the palmar aspect of the hand, which includes the Hypothenar eminence and the Thenar eminence. Now, one of the ways that we can differentiate between the two is to note that the Hypothenar eminence is the flatter mass of muscles that we'll find on the pinky or ulnar aspect of the hand. And we'll also note that the larger mass of muscles that make up the Thenar eminence on the thumb side or radial aspect of the hand. So first, let's take a look at the Thenar eminence muscles. What we'll focus on here, instead of identifying the action, origin, insertion, and innervation for all of these, is a listing of the names of muscles found within this group. Our Thenar eminence muscles include the Flexor pollicis brevis, the abductor pollicis brevis, and finally the opponens pollicis. Now let's take a look at our Hypothenar eminence muscles. Here we have the Flexor digiti minimi, the abductor digiti minimi, the opponens digiti minimi, and finally the palmar brevis. Now let's take a look at some additional muscles of the hand. On the palmar aspect we have the lumbricals, which originate on metacarpals 2 through 5 and insert on the proximal phalanx of digits 2 through 5. The lumbricals perform flexion of the metacarpal phalangeal joints and extension of the distal interphalangeal and proximal interphalangeal joints. And the lumbricals are innervated by both the median and ulnar nerves. And last but certainly not least, we have the Dorsal Interossei muscles. These muscles are on, as the name suggests, the dorsal aspect of the hand, and they originate from metacarpals 1 through 5 and insert on the proximal phalanx of digits 2, 3, and 4. Collectively, the Dorsal Interossei allow us the ability to perform flexion and abduction of the metacarpal phalangeal joints and extension of the distal and proximal interphalangeal joints. And last but certainly not least, this muscle is innervated by the ulnar nerve. Well, thank you for watching this video. I hope it's been helpful, and if it has, I look forward to connecting with you again in the next one.